Hey Mary, I'm Juliet. I'm gonna be your nurse for today. I'm going to get your antibiotics started and then I hope to talk about managing risks for future cellulitis infection.
Whatever. Just get the antibiotics started, then go. I have other things to do. I can't stand how you nurses think you can do whatever you want to me.
It seems that you have had bad encounters with other nurses. Would you like to share your experiences with me?
Why should I bother? It's the same shit, just a different day and a different nurse.
Just sounds so frustrating, Mary. What happened?
Damn right I'm frustrated. Nurses don't listen to me. You're the first nurse to have asked.
Of course, please let me know what your concerns are.
Well, first of all, the previous nurses are coming at inappropriate times. 9 a.m. is one of the busiest times because I have to get the children ready in the morning, cook breakfast, drop them off at school, then rush back for the appointment time.
I see what you mean. And I empathize with you because I have children too. And my mornings get very, very busy. Being a mom is not an easy task and it demands a lot of effort and time.
Yeah, and to make things worse, when I'm late, the nurses are getting mad at me that I can't make the appointment time and that they have other clients. Can you believe the audacity? Like, I have things to do too. Look at these dishes. They're not gonna wash themselves.
I'm very sorry, Mary. My goal is collaborate with you and develop a care plan that is meaningful to you, that is going to help you to recover physically and also emotionally. I think I can advocate your feelings to the healthcare team to change the current visits to something that works for you. Tell me more about those changes that you would like to do.
First of all, the timing. Anything after 11, since it's good, since the kids are at school, but before 3 p.m. because I have to pick them up.
Oh, I think that's a reasonable request. I can update your profile and all the team members can see your request in the electronic system.
Okay, that would be helpful. I'm sorry about my rudeness earlier. I appreciate you taking the time to listen to me vent.
Yes, I'm here to listen to you. My goal is to ensure that you are getting the care, the quality care that you deserve. What else can we do to make these visits more productive?
Sometimes I just don't know what to do. My husband is away, and I have two children with too much energy. They make a mess out of everything. I can't keep up with cleaning, and I don't have time to take care of myself.
I can see what you mean. And there is a lot on your plate, ranging from taking care of the family and yourself. I admire your strengths for being able to provide for your family independently. Do you feel like your stress levels are higher these days?
Yes, it's been stressful with the children, the housework, actual work, and I'm also in so much pain.
Tell me more about the pain. Isn't the medication that we provide you working out for you?
I've run out, and the medications are too expensive, and the pharmacy is too far.
Well, I can look into getting some financial support for your pain medications because we need to control that pain to reduce the stress and improve healing. Mary, have you considered ever to put your children in sports?
No, sports are too expensive, and we don't have that type of money.
Uh, I think since you are on income support, there are other benefits that you can apply for, such as the leisure access programs in the community centers in Vancouver.
What is that?
Well, it's an initiative by the community centers to help low income families. So you can enroll your children in sports, and there are also recreational activities for mom too. How does it sound?
Oh wow, that sounds amazing. I love Zumba. Dancing helps me relax.
Perfect. So I think being physically active is going to help you to manage your diseases. And it's also, now that we're talking about management, disease management, would you like to learn a little bit more?
Oh, I guess so.
Okay, so there are some risk factors that I would like you to be aware of that is going to prevent future cellulitis infections, such as hand hygiene, injury preventions, and also identify signs and symptoms of the infection. How familiar are you with those topics?
Oh, I know that redness, swelling, and pain are signs and symptoms of infection.
Yeah, that's correct. Also, if you have any fever, that could be a sign of infection too. So, how are you managing your diet?
What does my diet have to do with cellulitis?
Well, when you have a diet that is low in carbs and rich in meats, veggies, and fruits, it's going to prevent you from having high blood glucose. So normally patients who have a normal high glucose levels is going to heal faster.
Okay, I work at a supermarket, but I don't know what foods to buy.
Oh, no, no problem. I'm going to write down some healthy foods and then you can choose from the list. I think I'm going to do a referral to a dietitian too.
Okay, thank you for taking the time to explore my needs. I appreciate it. I feel less stressed and more educated.
Oh, you are welcome. So if you feel any concern, if you have any questions, please feel free to contact us. We're here to support you.
Okay,
Bye, Mary.
bye.